Hello y'all, my name is Jordan Edgeworth and today I'm going to be talking to y'all about diverticulitis. So the first thing I'm going to talk about is the disease process. So this disease is very common in the colon and in the small intestine. So what happens is, the first thing that happens is diverticula form in the colon wall, and that's just outpouchings that form. And then diverticulitis is just going to be inflammation or infection in the outpouchings that have formed in the colon wall. So some things that can cause, and also with the disease, it's going to form in the weakest point of the colon wall. So some things that can cause that colon wall to become weak is going to be a low fiber diet or a low fiber intake in your diet. Another thing that is a big contributor to your colon wall becoming weak is going to be age. Obviously, the older we get, things become weaker. The colon wall is going to be something that becomes weaker the older we get, and therefore people that are older have a higher risk of getting this disease. And so with this disease, if inflammation or infection is in the outpouchings in the colon wall, you can see bleeding or obstruction in the colon. And then also ulcers and perforation can form as the disease continues. Another thing that can happen is feces can get caught in the outpouchings that have formed, causing inflammation or infection. And if feces do get caught in these outpouchings, the abdominal pressure will increase. Alright, the next thing I'm going to talk about is the diagnostic procedures. So some common things they've used to diagnose somebody with diverticulitis is going to be physical exams or imaging tests. The most common thing used to diagnose somebody with this disease is going to be a CAT scan. A CAT scan is very effective in diagnosing somebody with this disease. What it does is it can tell doctors the difference between a mild case or a severe case. And that's also very important because it's going to tell doctors which patients will benefit from therapy. Alright, so medical treatment for this disease. So there are three main things that they will do to treat somebody with diverticulitis. They'll use antibiotics, pain medication, and a liquid diet. And then also, obviously, if the disease is severe enough, they will do surgery. They will perform a colostomy, which is going to be taking part of that colon out. So the pain medication, obviously, if you have inflammation or infection in your colon, you're going to have some pain that's going to come along with that. So the pain medication is going to help relieve some of that pain. Antibiotics is going to help get rid of some of that inflammation that is there. And then a liquid diet. You might be asking yourself, a liquid diet, why would they recommend a liquid diet to somebody with this? All that is going to do is that's going to help cleanse out their system. That's going to give them like a new beginning. Try to clear out some of them feces and stuff that's caught in them outpouchings. Alright, so lifespan changes. So they say that if you live in the Western countries, you're at a higher risk of catching this disease. And some side effects of this disease, the side effects are actually, they're not good. They're going to be chills, nausea, vomiting, fever, abdominal pain. And then if the disease is bad enough, you can also see some internal bleeding in that colon. So the side effects are really bad. The medical prognosis, the prognosis for these patients is actually pretty good though. So if they can catch the disease early enough in its phase, you'll normally be hospitalized from anywhere between 1 to 4 days. And so with this disease, they say that it affects 65% of those over 80 years old and only 5% of people under 40 years old. So that's actually a really important statistic because it's affecting over half of the older population. So like I was saying earlier, if your colon wall, with age, your colon wall is going to become weak. So with a weak colon wall, that is causing the diverticular forming, and that's causing the diverticulitis to set in. Alright, so some physical impairments in therapy. So with these side effects, most of your patients are going to be living a sedentary lifestyle. So all the sedentary lifestyle is somebody that, you know, isn't moving around a lot. They're not living an active lifestyle. And obviously, if you're having chills, fever, abdominal pain, nausea, and you're vomiting, you're not going to want to live an active lifestyle. So with that, muscle weakness can set in. So this is kind of where we step in. So some things that we can do as therapists to help these patients is breathing techniques. So if somebody is having a bunch of abdominal pain, you can only imagine what their breathing would look like. They're probably going to have a lot of shortness of breath. So teaching them breathing techniques is going to be very important for them. Another thing that's very important for them is patient education. Teaching them what good posture should look like. So if somebody, like I said, is in a lot of pain, their posture and even the way they walk could be abnormal. And so teaching them the importance of what good posture should look like and why we should have good posture is going to be important for them. And then even going as far to gait training them so they can get down what that should feel like is going to be important for them. And then just general exercising. They're probably not going to want to exercise, but exercise is going to be very important for these patients. So exercising, what that is going to do is it's going to help increase some of the strength that they've lost from living that sedentary lifestyle and, you know, not being active. And then also it's going to help their bowel movements. Increasing that blood flow and everything, that's going to help their bowels move better than what they have been in the past. So some precautions for therapy. It is very important to, if you're treating somebody with diverticulitis, it is very important to keep the intensity low. You do not want to increase that abdominal pressure. The abdominal pressure has increased, like I said earlier, from the feces that have been caught up in the colon wall, or if there's infection or inflammation there, that's going to cause that abdominal pressure to increase. So you don't want to do anything that could cause it to increase even more. And then also, if you see, therapy should be stopped immediately if you see anybody, if they're coughing up blood, if there's a DV2, if they have a fever. And if you have already started therapy, then you need to stop immediately because that means that there's something serious going on. Alright, that is going to be the end of my presentation. I hope y'all took something from that, and I appreciate y'all listening.